Epidemics know no borders. In today's interconnected world, an outbreak anywhere can quickly become a threat everywhere. The COVID-19 pandemic reminded us how critical it is to be prepared to prevent, detect, and respond to public health emergencies. In Pakistan, through the funding of US Center for Disease Control and Prevention, JPIGO has been at the forefront of strengthening global health security, working hand in hand with the Ministry of Health and partners across the country. To protect health workers and patients, JPIGO enhanced the capacity of health managers on provincial level and also supported 10 districts initially, developing 10 model hospitals for infection prevention and control across Pakistan. From Quetta to Karachi, Peshawar to Skardu, these facilities are safer, cleaner, and better equipped. Over 3,500 items, including autoclaves, waste management supplies, hand washing stations, and PPEs, were provided. As part of technical support, JPIGO also developed the first national infection prevention and control program to initiate national-level healthcare-associated infection surveillance countrywide under the leadership and guidance of National Institute of Health. The program has initiated healthcare-associated infection surveillance in 100 tertiary care hospitals, and JPIGO is proud to be the only implementing partner of the project with National Institute of Health, Pakistan.
मैं सबसे पहले तो JPIGO का शुक्रिया अदा करता हूँ कि उन्होंने ग्लोबल हेल्थ सिक्योरिटी सिस्टम मैनेजमेंट प्रोजेक्ट के अंदर कोटली को और आज़ाद कश्मीर को जो सपोर्ट किया और IPC एक्टिविटीज़ के हवाले से कोटली में 2021 से ये एक्टिविटीज़ हो रही हैं। डिस्ट्रिक्ट हेडक्वार्टर हॉस्पिटल को फैसिलिटेट किया गया थ्रू डिफरेंट सप्लाईज़ और टेक्निकल सपोर्ट और ट्रेनिंग्स के हवाले से। मुस्तकबिल में भी ये सप्लाईज़, ये ट्रेनिंग्स, ये कैपेसिटी बिल्डिंग और इस सिस्टम को जारी रखेंगे।
Laboratories are the backbone of disease detection. JPIGO strengthened 12 COVID-19 and national and provincial public health laboratories, improved biosafety, biosecurity, and strengthened diagnostic capacity under the guidance of the National Institute of Health. Over 600 lab professionals received high-level extended training in biosafety, biosecurity, and quality management. JPIGO has supported provincial TB reference laboratories and the National Veterinary Laboratory against the international quality standards and equipment management. Laboratory assessments, as per WHO tools and provision of technical support, showed a significant improvement in the laboratory quality management system and prepared the laboratories for the accreditation process. JPIGO also provided high-level technical experts to National Institute of Health and National TB Reference Lab, Islamabad, for routine biosafety and biosecurity protocols, implementation, instrument calibration, genomic surveillance, and outbreaks investigation. The support was also provided to National Microbiology Lab in AMR diagnostics and optimization of Oxford Nanopore technologies.
JPIGO through Global Health Security Project is supporting provincial TB reference lab regarding quality improvement, genome surveillance, and implementation of biosafety, biosecurity. We are committed to sustain capacity enhancement and look forward for having more close collaboration in future.
Time is everything during an outbreak. JPIGO worked with the Ministry of Health to strengthen emergency operation centers and trained over 24 national EOC staff to better manage emergencies. More than 250 members of rapid response teams across all provinces received training to respond to outbreaks such as COVID-19, Congo fever, and Mpox. Today, Pakistan's outbreak response system is stronger, faster, and more coordinated. The rapid response training was conducted on divisional level in the country, where first responders were trained on key components of rapid response and occupational safety.
प्रोजेक्ट ग्लोबल हेल्थ सिक्योरिटी के थ्रू आज़ाद कश्मीर में हमारे रैपिड रिस्पांस टीम की ट्रेनिंग प्रोविंशियल लेवल पे भी और डिस्ट्रिक्ट लेवल पे दोनों तरह की ट्रेनिंग्स और हैंड्स ऑन ट्रेनिंग दी, जो कि एक अपनी नौइयत की एक ट्रेनिंग थी। और इसने मैंने जो देखा और हमारे तमाम लोगों ने विटनेस किया कि इसने आज़ाद कश्मीर में हमारा जो स्टाफ इन्वॉल्व रहा है या इसके हवाले से जितनी रैपिड रिस्पांस टीम की कैपेसिटी बिल्डिंग की और उनकी नॉलेज और स्किल में इजाफा किया। और साथ साथ मैं चूँकि जहाँ जपाइगो का शुक्रिया अदा करता हूँ डिपार्टमेंट ऑफ हेल्थ की तरफ से, और इसमें हमारे प्राइम मिनिस्टर साहब, हमारे सेक्रेटरी हेल्थ, डीजी हेल्थ, मिनिस्टर हेल्थ, सारे लोग ऑन बोर्ड हैं और सारे इनका इसको एक्नॉलेज भी करते हैं इनकी जी सर्विसेज को, और साथ साथ उम्मीद करते हैं कि ये जो ट्रेनिंग है ये यहाँ नहीं रुकेगी बल्कि आइंदा भी उम्मीद करते हैं, आई एम प्रीटी श्योर अबाउट दिस कि जपाइगो विल कंटिन्यू स्पोर्ट्स इन एजीके फॉर मेकिंग एंड फॉर कैपेसिटी बिल्डिंग ऑफ ऑल दिस वर्कर्स, और हमारे लिए एक एसेट के तौर पर साबित होगा।
In Balochistan, one of the most vulnerable regions, Japaigo strengthened the integrated disease surveillance and response system. Post disastrous floods in Balochistan, 6 districts experienced double challenges: isolation owing to flood water, no surveillance system to report outbreaks, and infection disease cases. Japaigo, along with the National Institute of Health and Provincial Health Department of Balochistan, took the initiative of strengthening these hard-to-reach districts. Skilled human resources were deployed in 6 districts, training over 420 district-level staff across 95 health facilities. This enabled timely reporting and rapid mobilization during health emergencies, saving lives when it mattered most. All of the supported districts regularly report on IDSR, purely supported by the Provincial Health Department.
We are grateful to Japaigo for supporting in integrated disease surveillance and response activities in flood-affected districts of Balochistan. These support were in 6 districts of Balochistan through provision of HR, supplies and capacity building activities. In future, we are looking forward to have similar kind of support from Japaigo in another areas of health.
Clear communication builds trust. Japaigo supported the development of provincial RCCE plans across Pakistan through comprehensive consultations with provincial health departments. Master trainers were also trained, and the revitalization of RCCE task forces was carried out. This activity provided provincial health departments with province-specific risk communication and community engagement plans, helping in tackling pandemic information strategies. A national recognition event honored the frontline heroes of the 1166 COVID-19 helpline who guided millions of citizens during the pandemic. Diseases travel across borders, so must our defenses. Japaigo supported the border health services at airports, seaports, and land borders, including Karachi, Taftan, Torkham, and Sost. Training, surveillance, and improved coordination are now helping Pakistan detect and respond to health threats at points of entry. The seaport at Karachi was supported by strengthening isolation unit, provision of ambulances, human resource capacity building, and other patient care facilities. During the public health emergency of international concern of Mpox, Japaigo quickly supported points of entry through capacity building on timely detection, isolation, and reporting of suspected cases. This enhanced the capacity of airport authorities, airlines crew, and points of entry staff on timely identification, isolation, and transfer of suspected cases, preventing spread in the country.
Grateful to share the milestone achieved with the help and support of Japaigo at the points of entry in Pakistan just before the start of mission of Joint External Evaluation 2023. Border Health Services submitted a proposal to Ministry of National Health Regulations that was supported by Japaigo, and the support was in core 4 areas of surveillance, capacity building, vector control, and rapid response at the points of entry, especially at the Karachi seaport. Along with that, in the early days of Mpox being declared as the public health emergency of international concern for the second time in August 2024, Japaigo supported the trainings for the healthcare workers and the non-health workers at the small international airports of Punjab. This training support was crucial in the concept and in terms that these airports are bearing the heavy load of labor work class that is traveling from Gulf countries. So we are thankful to JPICO for this support and are looking forward to future collaborations and coordination for strengthening of the points of entry for a resilient health workforce and continuous capacity building at the points of entry. Thank you.
This system organizes past and ongoing trainings, reduces duplication, and helps identify future needs, making the tracking of disease outbreak easy in timely manner, ensuring Pakistan's health system continues to grow stronger. This system also has the capacity to address surge capacity needs as per international health regulations. Genomic surveillance is an important tool in preventing, tracking, and managing outbreaks. JPICO built the capacity of laboratory professionals on genomic surveillance in international training, where over 26 experts learned about modern genomic surveillance techniques and bioinformation pipelines. JPICO supported trickle-down trainings of genomic surveillance in the country, conducting trainings in KP, Punjab, Islamabad. JPICO also developed National Genomic Surveillance Dashboard under the technical leadership of NIH. The dashboard not only provides a one-stop tool for data analysis using the Galaxy software interface at the background, but it also addresses the challenges of global dashboards on genomic surveillance. The dashboard is going to serve as an important aspect of pandemic preparedness.
The Global Health Security Project had two phases. The first phase was purely for COVID-19 response, where we actually enhanced the capacity of diagnostic network, surveillance, emergency response operations, infection prevention and control in the healthcare facilities. We not only enhanced the capacity through trainings, but we also actually provided multiple supplies and materials ranging from ambulances, building and strengthening the isolation units, triages, and then autoclaves, hand wash stations, and so forth. And other than that, the second phase actually focused on the system building, because that is the core component of international health regulations. So in this component, we developed National Infection Prevention and Control Program under the leadership of NIH Pakistan, and now we are implementing it. We also developed National Genomic Survey System. We developed Training Information Management System to address surge capacity. We also supported ISO certification and quality management system in the labs. And also we implemented IDSR in few districts of Balochistan as well. So global health security is actually an ongoing process, and we need to enhance that. I'm very thankful for every person and every organization that has been with us. For instance, Ministry of National Health, National Institute of Health Pakistan, Provincial Health Department, consortium partners, and other organizations that have been working with us. But last but not the least, my wonderful team that has been doing a lot of work since last 5 years.
As we close the chapter on enhancing global health security EGHS project in Pakistan, I'm proud of the extraordinary journey we have taken together. Launched in 2020 amid the COVID-19 pandemic, EGHS set out to strengthen the country's ability to respond to public health threats. And today, Pakistan stands more resilient and better prepared to protect its people. Through the close collaboration with the Ministry of National Health Services Regulation and Coordination, the National Institute of Health, provincial health departments, and our consortium partners, we established a National Infection Prevention and Control Program, developed the country's first national genomic surveillance system, enhanced laboratory networks, reinforced border health services, and created the Training Information Management System, TIMS, to institutionalize workforce development. We also supported Integrated Disease Surveillance and Response, IDSR, in flood-affected areas of Balochistan, and trained hundreds of professionals in biosafety, biosecurity, and emergency response. This collective achievement, built on evidence, innovation, and trust, has strengthened laboratories, trained a capable workforce, and established robust surveillance and response system that will continue to protect communities and contribute to global health security long after the project ends.
From hospitals to laboratories, communities to borders, JPICO's Enhancing Global Health Security project has strengthened Pakistan's capacity to face tomorrow's health challenges. Together with the government and partners, we have supported resilient system building, protected lives, and prepared for a safer future. Because When health systems are strong, communities are secure.